Welcome, everyone. Welcome to the Health Board Foundation workshop on digital equity, our digital equity funding opportunity. This is the first in-person digital equity funding opportunity for Health Board, and welcome everyone. I wanted to introduce myself and some of the Health Board team in the room. My name is Jennifer Tidwell. I am the principal strategist for the PLACE team, which is digital equity and housing. And I also wanted to introduce our Vice President of Policy and Impact Team, McLean Bryant, if you can raise your hand. Angela Williams, who is with our learning team, which is next to her. And then the folks that are on the panel, Adriana Priscina, that is the impact strategist, and Alicia. Please, Alicia, raise your hand. She is going to be talking to you today as well. And the last person is Robert Gibson. I think he's in the room. He is our policy team member that is here. And I want to let you know that there are, we have done quite a few policy briefs, one on digital equity, and we really would like you guys to pick our pamphlet up so that you can use the QR code on that to actually get the policy briefs that we've done on digital equity, and they will be in the back of the room for you. Oh, about Health Forward Foundation. Every day we work to support and build inclusive, powerful, and healthy communities characterized by racial equity and economically just systems. To achieve our mission, we are using health equity and securing a fair and just region through leadership, advocacy, and resources. So I am going to turn the mic over to Adriana, who is going to talk about our purpose.
Please bear with us. We only have one mic, so we will do our best. And also, thank you for being so helpful to us and giving us grace and being here today. It's incredible that we have a packed room. And we hope that folks did get the message in time. We do have a sign at the other location letting folks know that it's here. So again, thank you for being here. So the Health Forward Foundation, we are under 20 years of age. We were created from the sale of Health Midwest hospital chain, and we have been working in 3 counties in Missouri and 3 in Kansas. But we have a new purpose plan that we have been implementing for the last 2 years, and we're really excited that this is the first time we've met in person for a funding opportunity announcement. So we're excited to be here. The purpose of our foundation, as you know, every day we work to support and build inclusive, powerful, and healthy communities characterized by racial equity and economically just systems. And the way we do this work is through 4 purpose areas. And those purpose areas are platform, people, power, and place. The platform strategy is really focused on narrative change, ensuring that when we speak about our communities of focus, which are Black, Brown, and rural, that we're speaking in an asset-based language and that we're holding ourselves accountable when we do speak about the communities of focus. We also are working on promoting and educating and just really helping others through that journey of race equity and economic inclusion. In our people strategy, we are strengthening strengthening equity-centered whole person care through capacity of the partners that we have, as well as community health ecosystems and diversifying the health sciences workforce. With our power team, which is the blue section, we are advancing capacity building, leadership development, and connectedness Much of the work that we're doing around power is on civic engagement, as well as working with smaller grassroots organizations, ensuring that they're successful and that they become a lot more sustainable, and that they also are successful, not just with our funding, but other philanthropic partners. The PLACE team is the team that is hosting today's funding opportunity announcement. And we're focused on advancing safe and healthy and affordable housing and home ownership, as well as advancing digital access, literacy, and equity. So today we'll be focused mostly on our advancement of this, reducing disparities in digital access and literacy. I mentioned earlier we were created less than 20 years ago. We are very much focused on 6 counties, 3 in Missouri, 3 in Kansas. The 3 in Missouri are Cass County, Jackson, Lafayette, and KCMO, including sections of Clay and Platte County. On the Kansas side, we are focused on Allen County, which is rural Kansas, southeast Iola, Humboldt, as well as Johnson and Wyandotte County. Again, I mentioned earlier about our place purpose area and our priorities. We're very focused on reducing gaps in digital access and literacy and increasing affordable home ownership, housing opportunities, both as pathways to health and wealth creation. In our home ownership and housing work, we are working on increasing the supply and access to safe and healthy affordable housing, adopting policies that improve and expand access to housing to maintain home ownership, and greater funding for opportunities for home ownership and creation of housing stock. I do want to also highlight, earlier you heard from Jennifer that our policy team with the leadership of Robert Gibson and Justin Moss, we do have a brief that will be shared. There's a link that will be a QR code that will be on the screen later in our presentation, but those copies are here available as well. Because policy, nothing can be sustained in this world, in this current environment we're in, without policies and advocacy. Now moving into why we're all here today, digital equity.
So the funding opportunity is to provide digital access, literacy, equity, and advocacy in our communities of focus. We are looking for proposals that reduce these disparities through the following: adoptions of policies and practices that promote digital equity, community-based organizations connected to our community of focus, increased digital inclusion through reliable connections, through high quality devices, and disparities through the following type of skill trainings. In addition to that, we think that technology opens the door to telehealth and job opportunities, increasing digital services such as telehealth, which will provide communications to access healthcare services remotely. Telehealth services can provide accessibility to communities that do not have local healthcare facilities, as well as for those residents that are not able to travel to a care facility. In addition to that, increasing the use of technology for job readiness and for education through STEAM and other avenues. As part of our evaluation, it will include how your organization engages with community partners in your digital equity proposal. Some key information. The funding amount will be up to $400,000. That's the total that we will be giving out. The funding term is 12 months, and the deadline is Wednesday, January 15, 2025. I wanted to talk about some of our funding priorities and to let you know the type of projects that we have previously awarded funding to. Training and literacy has been one of our big areas where we have funded, which not only provides the training and literacy, but also provides access to devices and how to use those devices. Educational opportunities by organizations that are associated with with STEAM, which is science, technology, engineering, arts, and math, and weaving in the educational component of digital equity, providing internet access and devices for that. Workforce also encouraging economic stability through employment and entrepreneurship and creating those job skills that use technology. Support for multilingual and multicultural communities. We have seen a lot of organizations that come in and they are caring for refugee families and helping them with employment, public benefits, healthcare using digital equity. And also access to workforce and entrepreneur development through digital equity skills. So there will be 4 questions on your application. As you go into our portal for Health Forward, how does your current work align with the strategies of Health Forward's purpose? So Adriana talked a little bit about each of our purpose areas. And in order for us to fund, we would like you to align with one of those 4 purpose areas. Tell us about your history, understanding, and connectiveness with Health Forward. This is really important for you to be able to tell us what you're doing previously and make it align with Health Forward's community of focuses and list your previous successes. So if you've done something that's really amazing, which I know most of you probably have done that, we would really like you to tell us what those successes are. Then what specific activities would Health Forward funding support and what impact do you seek for these activities? So make sure that in this question that you really talk about what it is that you want to use the Health Forward funding for and what impact you will have on the communities that you're serving. And then number 4 would be indicating the outcomes of your digital equity work. So we want to know what outcomes do you think you will perform during the time that you are using our funding. And so we really, and what would be the impact on our communities of focus. I'm going to bring Alicia up next. She's going to talk to you about portal access and how you can establish your credentials and log into our system.
Hi, nice to see everybody. So if your organization has already registered in the portal, you still have access to that. If not, you will need to register on the portal. In order to get access to our grantee portal, you will need to go to our Health Forward website. And once you go to the website, please click on money and then funding opportunities. And in the funding opportunities section, you're going to then see place at the top, excuse me. Excuse me. You'll see place at the top and you'll scroll and you'll look for the funding opportunity, excuse me. And you'll see the advancing digital equity. And once you click on that, open it up and you will see the funding announcement and in there will be access to the portal. If you are new, I'm so sorry, I'm recovering. If you are new, you'll click on new user and you'll register for the account. And then once you're logged in, to the portal, navigate to funding opportunity, click apply now and start a new application. On that, you will also have access to a template of the application with those 4 questions. You can complete those offline, if you want, just so you can keep track of your work and not lose it if you forget to save, and copy and paste it into the application. Please remember to keep saving every few minutes because it does not auto save as you're working on it. I think that's everything. And if you have any questions, feel free to email Impact Admin for help.
Thanks, Alicia. By show of hands, can you raise your hand if you are registered or have signed into our portal? You have, okay. So half of the room have and half have not, okay. If you have any difficulties at all, you can call us. There's information on the actual funding opportunity announcement that you were handed when you walked in today. The links are there. You can contact Alicia for the technical, if you have any kind of technical questions or issues. If you have content questions or issues, you can call me or Jennifer. Our contact information is on the FOA. There's also an opportunity for you to sign up to get a consultation with us, a 30-minute call so that we can just walk you through those questions. If you have any other questions, we can also assist you with that.
I just wanted to have Robert come up for just a minute to just talk about our digital equity advocacy and be able to tell us how to get to our policy briefs.
Thanks, Jennifer. I'll be very brief. Here's the QR code that we have here. I mean, this is a digital equity related opportunity. So we want to make sure that we are in line with the things that we do and being advanced and being up to date with the current way that we communicate our information. And so if you utilize this QR code, you'll be able to pull up the brief. The brief has recommendations and overview of the current digital equity landscape, why we are, having this funding opportunity, things that, we've looked at from a policy and advocacy perspective that may be helpful for you and your organization as you go on your own policy and advocacy journeys yourself. So please access this information. It is here for you, and we're here to answer any questions you may have.